I'm really pleased that my research has been acknowledged with this award. My research focused on hospital-acquired pressure injuries, which are also known as bedsores. And a lot of people don't know that they're actually quite a serious complication in hospital. So my research focused on how we actually prevent hospital-acquired pressure injuries. But although it's a serious problem, it's really not that much talked about. So I'm really, really pleased that it's being recognised by this award. I was working at a health district and hospital-acquired pressure injuries were increasing, and we were putting interventions in place, but they were still on the increase, and I was approached as to whether I'd like to lead this program of work in reducing them. We really wanted to do something different, use a different approach to be able to not only reduce them, but sustain them and prevent them from the hospital, so that our patients weren't coming into hospital developing pressure injuries. We conducted a number of studies, we put in some interventions, we looked at equipment, we looked at the way pressure injuries were being reported in terms of data to the Ministry of Health. We also talked to the patients and asked them about their experiences. We identified a range of initiatives and we put some task forces together. And once we started to implement these and talk to patients and get clinicians on board, and we had support from the leaders, we were able to reduce our pressure injury incidences substantially. We managed to halve our pressure injury occurrence, getting the rates down to the lowest in Australia. This way we were able to make a huge difference to the patient. We've had 12 districts also adopt the approach that we used. I was only thinking the other day, recalling how we had to think very quickly during COVID, and I was getting phone calls from clinicians during COVID asking, what are we doing in the middle of a pandemic to reduce pressure injuries? What I'm really proud of is the impact that we've had on patients. By reducing the occurrence of pressure injuries, we've been able to reduce their suffering and boost their recovery. There are so many people I'd like to thank. I'd like to thank the executive at City Local Health District for their leadership and support, particularly my manager Ivanka and the Chief Executive Teresa Anderson. I'd like to thank my PhD supervisors who really helped me with that approach around tackling this complex issue, and that's Kate White and Tim Wand. We had a number of patients who were involved in the study, so I'd really love to thank them. And of course, I'd like to thank my husband and my kids for putting up with me. Thank you.